Imagine experiencing a traumatic event that can harm your sense of safety, the ability to regulate your emotions, and to navigate everyday normal things. Today, we will be talking about trauma. So, what exactly is trauma? According to the American Psychological Association, trauma is an emotional response to a terrible event like an accident, rape, some type of violence experienced, or living through a natural disaster. There are three types of trauma. The first one is acute trauma, which results from a single incident. Second, we have chronic trauma. It is a repeated and prolonged, such as violence or abuse. And lastly, we have complex trauma, which is exposure to varied and multiple traumatic events, often an invasive interpersonal nature. When we feel stressed or threatened, our body releases hormones called cortisol and adrenaline. Studies have shown that stress signals can continue long after the trauma is over. The effects of trauma present in a person in emotional, psychological, or physical effects. Trauma can also make an individual more prone to developing long term effects like chronic illnesses. Trauma is different for everyone, states Kristen R. Choi, who is a registered nurse and researcher at UCLA. She studies trauma. She also states that you might have overwhelming negative emotions while dealing with trauma, or sometimes you might not be able to stop crying, or on the other hand, you can feel numb and be unable to experience pleasure or pain. I would like to give some examples on the effects of trauma according to WebMD. We will start off with the emotional effects. Following trauma, an individual may suffer from emotional effects including flashbacks, nightmares, feeling moodiness or anxious. An individual might feel sad, overwhelmed. They might be filled with emotions of guilt. They might be ashamed or be afraid. You may also develop sensitivity to noises or certain type of smells or things around you. In the worst conditions, people can develop PTSD, which is post-traumatic stress disorder. This causes an individual to always be in fight or flight mode, which can cause the brain to always be alert and perceive everything as a danger. In the long run, this can have a problem that leads to memory loss and many other chronic responses that the brain can have. Trauma can also cause physical effects that can include headaches, trouble sleeping, trouble concentrating. Some people might have substance abuse. It can also present into stomach issues like nausea or a change in appetite. It can also vary from chest pains to developing chronic illnesses. Lastly, trauma can interfere with normal everyday things, like making it difficult to hold down a job, to having difficulties with relationships, and even remembering things or simply making normal decisions. that would not be difficult for a normal person to make. With trauma, it would be harder, or some people might not be able to really think straight. Some people can learn how to manage their trauma with the right type of treatment, whether it be therapy or incorporating into a routine like exercising, community activities, or joining a support group would be very helpful to an individual dealing with trauma. In conclusion, today we have learned that the effects of trauma can linger for a very long time in a person's life. Some people might be able to let it go fast when it's a small experience. It may have been a one-time event or something that was chronic and ongoing. Most chronic effects include sexual abuse, violence, or emotional and physical abuse that went on for a long period of time. What we don't understand about trauma is that it affects each individual in different ways. Some develop acute symptoms, while others develop long-lasting effects like I mentioned before, PTSD or chronic illnesses. The trauma that someone suffers from a traumatic experience paves the way for many long-lasting emotional, psychological, and physical effects throughout a person's life. Next time you see someone, I want you to try to think or guess if they have been through any type of traumatic event or if they have suffered any type of trauma throughout their lives, how their behavior might indicate you that they have. And I also want you to think of ways that you can help this individual. And I want you to remember that dealing with trauma and its long-lasting effects is a very complex process that not everyone is ready to deal with, and it's something that takes time to get through it. Some people might not be able to get over their trauma completely, but with therapy, they might be able to manage it and have something similar to a normal life, or they just might learn to live with it and be at peace with it. My name is Stephanie Rivera, and I want to thank you for the time that you took to listen.